Welcome back to Living Local. Warmer weather means that it's time for spring cleaning, of course. Now, if you already have issues with your joints and your back, knocking out your to-do list could actually cause you some pain. And so we're hoping that we can alleviate some of that and talk about ways you can prevent different injuries from happening. So joining us here in studio today with all of those details, we have physical therapist Andy Hovey in this segment, which is sponsored by Advanced Rehab and Sports Medicine. So good to have you in studio.
Well, thanks for having me, Michaela. I appreciate it.
We're about to learn so much too, by the way. Very excited to dive into this. So before people begin their tasks, I mean, when spring comes around, you just feel that urge to get everything done.
Absolutely.
But what are some things that you can do to prepare to make sure you're good to go?
Well, the biggest thing is, for a lot of people, we're getting ready to get prepared to get this all cleaned up. We've got tons of projects around the house. Like in my house, we just moved recently, so I still have a lot of those tasks. But the biggest thing is to make sure that we're taking care of our back, our hips, and our ankles, and our shoulders. The biggest thing that I need to tell everybody is making sure that you get that warmed up. One of the biggest things that we see sometimes in the clinic is patients who will get done doing those tasks and they're like, oh, it really aggravated my back because I was lifting so many boxes, or maybe they had a really large lawn or something and they're like, I just want to get the lawn prepped and get the leaves up and start seeding.
Yes.
So we want to make sure we take care of ourselves first. And one of the best ways that I tell patients is to start moving, like if you're in a door frame, one of the easiest ones, because we want to take care of our ankle, we want to be able to take care of our hips, and one thing that a lot of people ignore is your middle spine is really, really important, because if we're locked up when we're tight in this part here, it affects how you try to lift and reach to the floor to grab an object or to lift an object. So one that I'll have is, we don't have a door frame here.
We don't have a door frame, no.
But if we had a door frame, we'd put our hands on the side of the door frame about shoulder width apart. And then what we do is we put one foot in front of the other, and we're going to go and use our hips. So everybody wants to think about using their head and their shoulders to come forward, but we're going to use our hips to mobilize our calf, because the calf a lot gets tight, especially if you're a person who tends to be a runner. And when you're running a lot and we don't address those as often, then they're going to get tight. And so that's one big thing when you're trying to lift. If you don't have the ankle mobility and what we call dorsiflexion, and those muscles are tight, they're going to stop that from happening. So when you're in a door frame, hands at shoulder level, you're driving with those hips, and as you're doing so and keeping your foot straight ahead, you're going to work on that muscle called the gastrocnemius. That's one of two calf muscles. The other is you end up lengthening the front of your hips. So we have tight hip flexors. We live in a chair-borne society.
Yes.
We've been in a pandemic for a really long time. And so with people that may be sitting for their jobs, this musculature that attaches on your low back, from the back to the front of the hip, gets really tight and adhered. And so we want to make sure we mobilize that, because we don't want to compress the spine when we're doing these different tasks.
When you're doing the different tasks. So let's get to a couple of these tasks to show people. I mean, boxes, we have them everywhere. Maybe you're cleaning out your garage, maybe it's your basement, whatever it may be.
Absolutely.
What's a good way to lift a box?
So the big thing when I approach, or I tell patients or athletes or clients how to lift, is the first thing I hear a lot of people say, well, I'm going to lift with my knees. I'm like, not quite.
Like, maybe don't do that.
Exactly. So the big place we want to use is the larger bone structures of our body, because that's where you have the largest muscles to support that, okay? So I always suggest to patients, we want to make sure that we're utilizing a good hip hinge. When you use the hips, you're going to engage your abdominal muscles, you're going to engage your pelvic floor, which for some people may not hear that term often, but it's really important. When you get to a squat and you get past what we call parallel, when you hit about 70 degrees and then a little lower past parallel, that's when the pelvic floor muscles are really engaged. They will help the lumbar spine out. They will help the hips out. So we want to try to keep a straight, tall posture, but when I say straight, I don't mean rigid. I mean reactive. So it's just nice and relaxed. You want to have a nice base of support. People have a tendency to kind of go narrow because they feel like they have support underneath them, and it's actually not correct. So we want to get a nice base of support, so that way when I go in my hip hinge and the weight goes back, I can lift, keep this close to my body here, because the further out you go, the more torque you're going to put on your spine, your shoulders, and even your neck. So you always want to keep that in close to your body. And then whenever possible, I'll tell people, just use your hands like meat hooks. That way you can just bring it to the floor and not overstress yourself.
Okay, that's awesome. Now we'll go to the vacuum here.
Absolutely.
Because that's another thing that people can potentially hurt themselves while doing.
Exactly. So with vacuuming, one thing that doesn't get talked about a lot is that when people are vacuuming, and I notice with this with patients when they come, they'll show me this when I'm doing an evaluation, is they have a tendency to stay kind of stuck. They lock their legs out, they lock their hips out, and they just use everything with a shoulder motion here. And what can happen is the further out that your arm is away from your body, you put more rotational torque through your spine. If you happen to have degenerative disc disease or joint disease, or maybe you have a bulging disc or a herniated disc, that can create compression to it and then push on a nerve. Some patients or people may have sciatica out there, and that can inflame it. So you always want to keep that vacuum within the center of your body and then drive and weight shift. So if I turn towards you, Michaela, to show the audience, we want to make sure that we're weight shifting and extending. So I'm using this part of my body, foot, hip, and shoulders to drive that, and then I weight shift to pull it back. That way it doesn't put as much strain on yourself when you're doing that.
Okay, and that's very important. Now, we have run out of time.
That's okay.
Unfortunately, but there's still a whole lot that you can teach folks. How can people get in touch with you?
So you can get in touch with us at Advanced Rehab in sports medicine. Here we have offices in Bettendorf and Moline, or you can also reach out to us at advancedrehab.com.
Okay, fantastic. Very good tips. Hopefully you got something out of this, and thank you so much for coming in.
You're welcome. Thanks for having me. I appreciate it.
Of course. Now, again, this segment was sponsored by Advanced Rehab in Sports Medicine. Now, for some more information, you can check them out at advrehab.com, and we will, of course, have these details posted over on our website, too, at ourquadcities.com.